So diastasis recti, or DR as I will call it, is when the superficial abdominal muscles, so the six-pack abs, split apart to make way for the expanding baby as your belly gets bigger. It's not actually your muscles that split apart, it is the fascia, the bit in between your muscles that knits them together. That's the bit that stretches. So there's actually nothing wrong with your muscles. They are still there. They're probably a bit out of practice, but they are still there, and you can absolutely knit your muscles as closely back together as possible. It could be that they never make it the whole way, and that is okay. That's absolutely fine. It doesn't mean that you are never going to have a core again. It doesn't mean that you're never going to be strong again. I need to make that very, very clear. So in order to knit the muscles back together, we actually need to forget that we're even worrying about these muscles. We need to worry about the sheath of muscles underneath. So these six-pack abs here, your rectus abdominis, sit on top of your transverse abdominals. Your TVA stretches all across the front, and it makes up the front part of your core. And your obliques make up the side, diaphragm is the top, pelvic floor is the bottom, and all of these muscles at the back make up the back of your core. The whole thing is a cylinder. So in order to rebuild it, we have to address it all. At the moment, we're going to just address the TVA. It is a deep core muscle, so it does mean that it might not look like we're doing much. In order to work it, trust me, you don't need to do much in order to fix this core muscle, especially if you are only just postpartum. So how do we find out whether or not we have diastasis recti? Well, we need to pop ourselves onto the floor for that. Making your way down to the floor, knees are going to be bent, shoulder blades relaxed into the floor, feet flat on the floor. And we're going to place our hands at our belly button, and we're going to apply a little bit of pressure. So it could mean that you have to essentially dig around to find it. And then slowly lifting your head and your shoulders off the floor. It won't take much. Please don't do a sit-up. Just your head and shoulders off the floor. And you should be able, again, have a dig around, to feel the sides of your rectus abdominis, the sides of the walls of your superficial abs, your six-pack abs. And depending on how far postpartum you are, it could be that you've got 1 finger, 2 fingers, 3 fingers, maybe even 4 or 5 fingers. But once you put them down there, feel the squeeze each side of your fingers, and then you'll see that's how many fingers you have of DR. If you do have DR, please don't worry, it is completely normal. It happens to most women who go through pregnancy, and it is not necessarily easy to fix, but the exercises to fix it are easy to do at face value. They just require a little bit of motivation, a little bit of determination and commitment. And the more often you do them, the more likely you are to be able to see results quicker. So it's not about how hard you do them, it's about how often you do them. Consistency is absolutely key with these types of exercises.